Greetings, 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 and welcome to Conversations with AARP in the Virgin Islands. I'm Troy Deshabere-Schuster, the State Director of AARP in this territory, and once again, it's a pleasure to be with you today to bring you important information impacting our territory and especially the 50-plus-year-old population here. And today we have a very pertinent show as we continue to journey through the pandemic and as vaccinations are being rolled out across the territory. We have with us today Daryl, who is the Director of the Virgin Islands Territorial Emergency Management Agency, VITEMA.
Yes, good afternoon. Thanks, Troy. Thank you very much for the opportunity to join you today.
Thank you. It's a pleasure to have you with us again. We had you on the show a couple of months ago, and now we're back again discussing other important things regarding the work of VITEMA in this territory and all the good that you do. So to start off with, it's my understanding that Governor Bryan declared a state of emergency, a healthcare state of emergency for the territory regarding the pandemic. Tell us more about that detail and if my understanding is correct.
Oh, yes, you're right on track. This way goes back to the 13th of March, 2020. And we were watching territorial-wise where COVID-19 was expanding, throughout the world. The Commissioner Carciano and myself had been watching what happened in the U.S. up in Washington State. We watched the emergence, and we looked also in the Caribbean to find out, where was this coming and what were the conditions that we recommend to Governor Bryan. We did do a declaration. So we had, very nearby, we actually had our first COVID positive occur on that Friday the 13th. And the same day, the President of the United States declared a national emergency also. So Governor Bryan could not have timed it, any better as far as declaring a state of emergency. And what that brought to the territory, both from a resource perspective with VITEMA and the Department of Health, was very, very important to set the conditions for what we're still doing today, as well as to bring in our federal partners right at the same time frame.
Excellent. Did other states in the Federation declare a state of emergency also with regard to the pandemic?
In some cases, they had done that, back in California, Washington State, in some cases, I think an actual city declared a state of emergency. But once the federal declaration was done, a lot more states did pick up on that. Our timing was incredible. We watched that happen, and we had not seen it quite coming yet, but the same day we announced it, again, we had our first positive case within a territory, and we weren't quite sure what that meant. We just know we had to be ready. We weren't sure how fast it was going to expand, how contagious it was, and we knew we were going to be in it for a long haul, but we weren't sure. You remember, the borders to Europe hadn't been closed yet, so it was really just between China and the U.S., and we really had to figure out, where else we were going to see the presence coming. Remember, the Center for Disease Control was involved. The WHO was involved. They started doing these transportation, interstate, inter-island, inter-country measures that trying to contain this. But as you know, the pandemic had an incubation period of up to 14 days. So after they started even bringing people back from China, we already had the pandemic in our nation. And of course, down here we had our own challenges.
Absolutely. And so when there's a state of emergency declared by the governor, what is the role of your agency, VITEMA?
Mm-hmm. And it doesn't matter whether it's a hurricane or a pandemic or earthquake, it's basically the same role. We start working together, and we do what's called a unified command. So the agencies come together and we work together to come up with the right sense of purpose and focus, for the territory. And may advise Governor Bryan as far as what conditions we need to put in place. In some cases, the VIPD gets involved a little bit more from a law enforcement perspective. Department of Licensing and Consumer Affairs, they did some price freezing, so there's no price gouging going on, by the private sector. Unfortunately, some people take advantage of that. But ultimately, we pull our resources together, both figuratively and physically, to develop a unified command, going back to the incident command structure, which is the basis for all states, agencies, even a federal, partners to get involved with this, to see how do we tackle this step by step under emergency conditions.
So in other words, is it accurate to say then that during a state of emergency, VITEMA brings all of the pertinent departments of the government together and coordinates everything in response to the emergency?
Yes, definitely. And it's really figuring out which agencies, need to step up and be part of this and how active they get involved. Obviously, when we declared a state of emergency, Governor Bryan made a decision, rightfully so, that Department of Health would be the lead agency. And then VITEMA would support, and our support operations, because I have logistics, I have plans, I have operations, I have admin finance. So I already have that structure that exists. I have communications. Today we're using, different means of communication that are not face-to-face. So we had to stand that up together, make sure we could have that conversation, understanding social distancing. And of course, the personal protective equipment. Remember, we were trying to fight for everybody, throughout the world for that same, protective mask, the social distancing that goes with it, and how important it was to get the mask and get the hand sanitizer in, get the gloves in place for those first responders. It was so important. So we helped also raise up the bar to the federal side of the house so we could fight for the territory. Remember, we had the national stockpile.
Yes.
So they had that left over after the previous events. So we are going back and putting a request in for our agencies that had the high risk, the hospitals, the BIPD, those individuals that were out and about in the community were at risk.
So as you mentioned, VITEMA's approach is very comprehensive. There's a state of emergency, whether it's a hurricane, a tsunami, a healthcare issue like a pandemic. Is FEMA the same way? Does FEMA respond to health crises also?
Very, very much so. And initially when we started out with the pandemic, we had the Center for Disease Control and the U.S. Health and Human Services were the first agencies that sort of reached out to all the states and territories. But because we had so many, actually we call 64 jurisdictions involved, it overwhelmed them. They had a hard time getting the distribution out for all the personal protective equipment. So FEMA stepped up because FEMA has a tremendous logistics capability. So we started working with them. And of course, for us, we had to get personal protective equipment flown down here. So we had to work with them. We had donations that were coming towards us, and that's a normal process by which FEMA controls that. The one thing FEMA did not get involved with was any medicine. So as they went through the first set of drugs that were coming down to the hospitals to help, that had to still go through the medical chain. And even today, a lot of what's happening today is not being done through FEMA, but they're still supporting behind the scenes and for communication and make sure the prioritization is set up.
Excellent. And it's wonderful that we have such a strong presence of FEMA here in the territory since Hurricane Maria. So I'm sure that was a real help having them right on the ground here.
I can tell you, Bill Vogel is a name that all of us know. If you've been in the territory, any particular time, he very quickly turned over to myself and to Governor Bryan and said, look, let us know how we can help. And so he really took some of that recovery staff and, he'd redirected some of them, plus we brought some more individuals down here. Mr. Mark Walters, from the territory, was already down here working with me, and he really has helped develop that liaison between FEMA and VITEMA and the territory, along with the Department of Health. And of course, now we bring the National Guard on board with this to see how they can help provide support also.
Well, it's very comforting and reassuring to know that the federal government, and in particular FEMA, is always looking out for us. It's a rather vulnerable feeling when you're on a small island surrounded by a lot of water and far away from the U.S.
Yeah, very much so. I would add, early on, we're all about the science of this and trying to figure out rules and responsibilities. So I go back to the logistics chain. FEMA could get things down there so much quicker, and we could see visibility when it was coming in. So that really helped us logistically. And that's one of the roles that VITEMA took on, was a logistics transport piece of this to make sure when the personal protective equipment came in, we stored it, we maintained it. As I worked with Property and Procurement Commissioner Thomas, as he had some monies from the CARES Act also, that we would go out and we would go look at purchasing. It was a weird time because they were saying, you need to order a minimum of 1 million masks. You're like, we don't need 1 million masks. But that was sort of the environment we were in. They wanted us to give them cash ahead of time. Governor Bryan was, there's no way. So really, the federal side helped link to us and helped us as a smaller entity get the same, response and effort a bigger state got.
Fantastic. And so what are some of your plans ahead now as we're looking into the proximate future? regarding?
Yeah, initially we started, again, with Department of Health, the lead agency, we started looking at, how do we help them with the, the testing perspective, the communication perspective, what are we going to do? We have the outreach number. You sign up for the 888-777 number, and we give you the updates on the COVID testing from the day before, where the positive cases are, the pop-up. But now with the vaccination ability coming out, we really we redirected VITEMA's role now. When Commissioner Carson and I got together a couple of times, we said, okay, how can we work together for the betterment of the territory? How can we advise Governor Bryan and let him know, what's going on? So we started listening to the feedback from seniors, listening to other states, agencies, and we heard everybody was fighting to try to get this vaccination. It became sort of a hunt. We have our providers that have the vaccination, but they were overwhelmed with people calling up and wanting that. The whole screening process was very difficult. And so, the provider, we have 31 providers today that can provide that vaccination. Some are better than others as far as their capacity, but really it became a challenge of them to get that appointment scheduled. So the Commissioner Carson and I talked about this, and we said, I said, can VITEMA stand up a hotline to help on the appointments and work with those providers that want to? So we started actually last week, the 2nd of February, it went live. So we spent about a week and a half figuring out how we're going to do that. We have not received any additional staffing. So it's out of our own VITEMA staff. We've done this. I have 6 individuals that are on the telephone right now. And Vaya's been great to work with us, with additional lines to set up. So we have it going from 8:30 in the morning to 3 o'clock in the afternoon to get hold of an individual that talks to you on the phone about getting the appointment. So that's been very beneficial. We're getting between 150 and 170 calls a day right now. After a week of this, about 42% of those are the seniors, 65 and plus. So we really appreciate the word going out, and it's a 340-777 VAX, VACS, which is 8227. Again, 8:30 to 3 o'clock, we have someone available on the phone, English and Spanish. Mm-hmm. So please, if you're Spanish, you can call. We will work with you and get the appointment set up for you. Also, the VITEMA website. Everybody knows the VITEMA.vi.gov. We have forms to fill out if you're savvy enough to submit that way, both in English and Spanish also, so you can submit your request. And then after 3 o'clock, I actually have a different team that works with 15 of the 31 providers actually getting those appointments set up. And the challenge right now, you're not going to call today and get an appointment next day. So, right. Please, you have to be patient, and it's no different back in the States, but you get a chance to one call to coordinate with you. And we try to find out, obviously, which island are you on. So when you call the 340-777 VAX, the option 1 for St. Croix District, option 2 for St. Thomas, St. John Water Island District, and then you get to a person, and we try to get that focus for you. And then realizing, it's just not one vaccine shot. You have to get 2 shots. And we're finding a challenge, not just in the territory, but the states also. A lot of individuals are saying, I have my vaccine, but you don't reach that confidence of 94.5% that you're protected until you get the 2nd dose. And it's called a booster shot. So that's part of what the provider does. Once you get in there, they give you a card, they give some information about when to get that 2nd shot. Now, some individuals have lost their cards, they can't remember. So I've also partnered with the Department of Health and said, how can we help you if you forgot, I need a 2nd shot? If you call us at the same number, the 340-777 VAX, 8227, we will get that information, your name, to the Department of Health, and they'll look up in the database and we'll let you know when you got your shot, when your next one is due, which provider can do it for you. And of course, if it was Moderna provider, it has to be Moderna also, or Pfizer. It has to be a Pfizer. You can't mix the different vaccinations at this point.
At AARP, we're so very appreciative of you standing up that hotline number for our listening audience, and for you, perhaps you don't know the details of the behind the scenes, as it were. At first, when the vaccines became available here at AARP, we started receiving lots of calls and email messages and people just running into us and stopping us on the street saying that they don't know how to go about getting the vaccine. Especially older people who are not digitally attuned. They're not looking at Facebook, right? They're not looking at the different periodicals online that was giving out a lot of this information. in a way that's very accessible to those of us who are digitally attuned, but not to those who are not attuned. And so we thought at AARP we need to do something to get them connected and to get the information out. So we reached out to the Department of Health, to Commissioner Encarnacion, who was a real joy to work with, and we explained to her and her team that we need to, number one, get the information out in a different way, and that AARP would help to do so, a way that's more accessible to people who are not surfing the web all the time, and also that we need to do mass vaccination, vaccination drives. Vaccination drives are always very, very helpful, and so we needed to organize that somehow. Subsequent to that, we sent a letter to Governor Bryan asking him to remember the 65 plus population, put in copy in that communication, and also saying that ARP stands ready to help. And then shortly after that came the hotline. So we're really, 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 really appreciative of that. And I'm sure that's making a really big difference in lives.
And Governor Bryan takes this very seriously. He wants us to be able to get the vaccination when we're ready for it, and according to the risk or the phase at which we're in. If you haven't heard the discussion, instead of just saying everybody get the vaccination, under the Center for Disease Controls and Department of Health, they set up a couple of different phases. The age 65 and plus has been in there since phase 1 alpha. We're in phase 1 Bravo right now, so still we're not closing a phase out. So if you're that age up, definitely want you to get a vaccination, but you're also competing with those individuals who are also considered frontline essential workforce. So just realize it's not just 65 plus. You're having to deal with the grocery store workers. They're up front. You're looking at potentially, the taxi cab drivers, those individuals, TSA that's up at the airport, those that obviously have a high risk, healthcare providers, long-term care facilities. So there is that, but we definitely want to listen to you. I understand that's a very important group when you call in, to make sure we listen, we understand your needs, and we're able to support you with an appointment for that vaccination, that first dose, and realize you have to go back for the second dose also.
Yes, and so what we'll be doing at AARP, we'll be sending out email blasts to over 5,000 email addresses here in the Virgin Islands. We are going to be doing a direct mail of a postcard advertising that vaccination hotline that you have provided, and that will be mailed directly to 10,000 post office boxes in the Virgin Islands for people aged 60 years and older. And we'll be putting it on Facebook, hoping and boosting it throughout the territory, hoping that even younger people will see it and point it out to their parents or grandparents or great-grandparents, as the case may be. So we'll be doing public service announcements on the radio, and so that's AARP at work in your community, ladies and gentlemen, helping to get the word out.
That's phenomenal. I mean, the more we work together on this, the better we'll be able to achieve, that. And then the commissioner calls it herd immunity. So we have enough individuals who are vaccinated so that virus has nowhere to go. So that's what we're trying to achieve. And we know there is some hesitancy in the territory, and we'll work also with the Department of Health to overcome that hesitancy. So outreach, coordinating programs. VITEMA is going to help manage the actual vaccination. So once you get to the point you want the vaccine, give us a call. If you're trying to figure out, is it right for me or not right for me? That's really a Department of Health conversation, and we have Department of Health individuals partnered in outreaching. Make sure we have those conversations that go forward to make sure you're comfortable as you go forward. Of course, if you are older, you want to make sure if you have issues or concerns, you talk to your medical healthcare, professional, and you get the okay from them also. Part of the requirement when you get the vaccination, you have to wait a period of time after you get the vaccination. You just can't get it and say, thank you very much, and leave. You're required to stay at least 15 minutes. If you do have an allergy, if you will, to certain things, they'll ask you to stay about 30 minutes. And they're there for the nurse to watch just to make sure anything that could go wrong, someone's there to provide assistance. It's a very small risk, but there's a requirement for all the providers. If they all give them the vaccination, they have a professional there ready to respond in case something does happen.
The one thing that we have been gently advocating for here in the Virgin Islands also is for those older people who have a caregiver, right? So that those caregivers could also receive the vaccination, because that's really important. Of course, we need to prioritize the 65 and older population, But in the case of those who rely on a caregiver, I mean, first of all, we know that the vaccine is approximately 95% effective. We don't know who would fall in that 5% of inefficacy, right?
Yeah.
And so if the older person happens to fall in that 5% where the vaccine is not going to work, how awful would it be if their caregiver brings the disease home to them, which has happened in many cases all across the country and all across the world. Furthermore, say the caregiver becomes ill and becomes hospitalized or passes away, who then provides the care for that older person? And that becomes a real burden on that person and on the entire community. So we're hoping that along the way that caregivers, I mean, people who really rely on somebody to provide care for them, right? That those caregivers can receive the care as well. But I'll be speaking more with Brian about that and with the Commissioner of Health, because we need to support those caregivers to make sure that they can continue providing the care that older person needs. Now, we have heard also that there are lots of people coming into the territory from the mainland to receive the vaccine. Have you heard about this? And is there any response to that? People flying in for vaccine tourism?
I guess there is some validity to that. I wouldn't say lots of people. I mean, tourists will come in. If they want the vaccine, they can request it. We're not asking for any verification. And the thing I keep telling Commissioner, I keep telling Governor Bryan, you don't go to the front of the line just because you're here for 2 weeks. That's the key thing. This is a worldwide pandemic. We're going to solve this together. But you're not going to, you have to be part of still that requirement for those phases. If you don't meet the category, you will not qualify for the vaccination, no matter you're here for a tourist or not. If you do qualify, you have to go according to the order in which you called in and prioritized. So again, just because you're here for the weekend does not give you any priority. Now, let me pause here for a second, because what's happening, unfortunately, the providers are having quite a few of no-shows or missed appointments. Mm-hmm. So when this vaccine comes out in the morning and they prepare it, you only have about 6 hours to basically use it all. Mm-hmm. Mm-hmm. So it's very important that each provider sort of has this backup call list that says, here's my individuals. If you get down towards the end of the day and I have 5 doses left, they will make some calls out to individuals they've talked to that still want to get it, but they have to be able to get there in about 30 minutes or so. So sure. Again, one of the things Governor Bryan and Commissioner Carson, we don't want to waste any vaccination. Don't want to lose any. We want to make sure we get it in the arm to maximize what's called the allocation that's come down to the territory. So, you have an official way you go forward. If people are missing appointments, and unfortunately people are, in some cases I'm hearing they're making 3 or 4 appointments. In some cases they've called back to VITEMA and said, I got in for that vaccination. I don't need that appointment. So that's just a evolution we're hearing about. Again, there's 2 doses. So, once you have the 1 dose, if you miss your next appointment, 21 days, later for the Pfizer and 28 days for Moderna, there's a doctor's decision that has to be made. You can still get it, but the question is, instead of 94.5%, it may become 80% or less. But that's the medical professional. That's why it's so important when you do get that first dose, when the second one is. You put it on the refrigerator magnet in your house to make sure you know when to go back and where to go. And you tell someone else, if you have a caregiver, you tell them that. Right. So we don't want anybody to miss their second dose either.
Exactly. Very important to get both. And we're hearing all over the United States that there is a problem with supply. I believe that recently with President Biden becoming the president, that's maybe improving somewhat. But how has that supply been for the Virgin Islands? Are we getting all that we need? Is it flowing freely? Are there any difficulties for us here?
Right now, we're having no difficulties at all. And in fact, today we ordered the last part of our allocation going through the end of February. And really, the commissioner, we work very closely with, obviously, the Department of Human Services, the CDC, and we do have weekly conversations, and the federal side's watching us, our consumption also, to make sure we're on track. They're still going to send it to us, but we don't want to have it sitting in a refrigerator or a freezer. In this case, we want to make sure what comes to us, we have the cadence in which we're using it, and of course the providers. Again, having 31 providers in a territory available to do this without having to go to mass vaccination is incredible. And those are places where to go to. Those are already existing areas. One provider's opened up a whole new vaccine center right now. Even better for the territory, they can do that. Just focused on that, and it's wonderful to hear. We want more providers to do that. So your comfort level is there, but right now there's no supply problems at all in the territory for us. We're very much watching very closely the supply chain and very much watching our consumption of the appointments to make sure we don't have a problem like that.
Excellent. And so you mentioned that you already moved through 1 alpha, phase 1 alpha, and into phase 1 Bravo. When do you start on phase 2?
Well, the next phase is going to be 1 Charlie, and I have a lot of other, territorial agencies. We're also trying to work with them, as well as, again, the retailers come up in 1 Charlie, and then we'll go to phase 2. So it all depends upon, have we saturated with 1 alpha, 1 Bravo before we go to 1 Charlie. So that's why there's a little bit of sense of urgency that, if you're thinking about whether you do or like the Taxi Cab Association, for example, myself and Miss Regina Brown, my deputy director for plans, we went down and talked to them one evening down at St. Croix Airport, and about 20 individuals, and 3 of them already had the vaccine, and we go get them set up. So we want to make sure, they go through that question, they understand it, and they make that decision and go forward. So we can get that group, whoever wants it is done. Because at some point we're going to say, we're going to move on to this next group. And really, as you open up each of those phases, it almost doubles the population available to get that vaccine. So even though you're 1 alpha or 1 Bravo, once you open up 1 Charlie, you're now competing with everybody else. So that's why it's important you ask these questions now, get the answers. We are talking about down the road here, probably in the month of March, being able to offer what's called mass vaccination, which gives the ability to have a lot of other individuals. This part goes back to President Biden opening up the military to provide this service to us. We're already asking for a small team to come down of clinical providers to be able to put shots in arms at a higher cadence, if you will, than we're doing today. But of course, the supply has to be there to support that. We need to make sure that the population is ready to get that also. So we want to put, potentially, 500 shots in the arms per day.
Excellent.
And that's phenomenal. Right now we're probably doing 250. But I think in some cases we can double that. But we want to make sure the population is there, plus the supply is there. We had a conversation today with the federal partners to make sure they understood our plans and desire to go there. I can tell you, again, 31 providers doing a wonderful, wonderful job getting that out. And in some cases, the pharmacies will come on shortly. We still haven't finished that up with the federal side of the house. But it gives you a comfort level to be able to go where you want to get. You're used to going to your providers. We haven't determined whether it's going to be a walk-up service or a drive-through service. Some of the states are doing a drive-through service. Obviously, our terrain here on St. Croix is a lot. We have more terrain than St. Thomas, and even more than less than St. John has. So we have to be very careful as we open up these, how we can transport individuals out and about, and be involved in bringing their cars in. Make sure there's enough room for all of that.
Well, thank you so much. We have just run out of time, but very briefly, what is that hotline number again? The hotline number?
It's 340 and 777 VACS, which is 8227. Plus the website, vitema.vi.gov. You can fill out the form in English or Spanish and submit it.
Okay, well, fantastic. Director Jaschen, thank you so much for being with us today, and we look forward to a future conversation.
Always, Troy. Thank you for your time also. I appreciate your time. Thank you.
Thank you. Bye-bye.